I am super excited to share this expert insight with you with a good friend and a former colleague, Salvatore Sulimay. It's not often you get a chance to sit down and speak openly with someone of Sal's caliber, especially considering how rare it is for professionals at large organizations to be allowed to speak publicly. So we were lucky enough to catch Sal during a unique window. He was just leaving one company and stepping into a new role, making this insight all the more special for you. Sal has sold some of the most prestigious products in the surgical space. He has worked for multi-billion-dollar companies, and he has served in roles that have spanned the entire United States. He's incredibly impressive. He earned his bachelor's degree from Temple University with a focus in pre-health professions. He played club rugby there, and he was active in their professional sales organization, which helped him in getting his first role. Sal quickly landed his first medical sales role with Stryker in the Mako Robotics division. And that's where I met him. We were part of the same sales team selling the Mako robot for our respective territories. And then he went over and joined Siemens, an almost $100 billion global conglomerate. We both worked there as well. He was in a national role. And just before our hour-and-a-half conversation, Sal accepted his new position as an area sales manager for Intuitive, where he'll be representing the most proven and widely used surgical robot in the world, the Da Vinci robot. I've been fortunate to work alongside Sal, and I can confidently say his insights are as sharp as they are valuable. I'm excited for you to hear from him, Sal Sulimay. We should actually, what I don't know is how you got into medical sales.
Great. Yeah. So, Pedro, appreciate you guys having me on. Going to be talking about kind of background, medical device sales, direction we're going to go, how to be competitive in the market, and ultimately land a role in arguably one of the most lucrative jobs and fulfilling jobs you could out of college or beyond. What I would state is, how did I get into med device sales? My undergrad was Temple University. I was a pre-med undergrad, and I thought I was going to go to medical school, and didn't train out that way, had a very humbling upbringing. And so I had to take care of the family. And so I was like, how do I make money quick? But I loved medical. Always have. I've been kind of a nerd since growing up. I remember reading Discover magazine when I was 15 years old about Hugh Herr, who created the U-foot prosthetic, who now runs Boston Labs. Yeah. For
so
robotics.
That always interests you.
Yeah. I've been interested in it ever since I was younger.
Okay.
And then just kind of has carried out throughout my life. I knew a guy, his name was, through my dad, his name's Drew Domino. And Drew was a Philly guy who was in the medical device, but I never knew what it actually meant or was. I always saw him in a suit, or I saw him in scrubs.
Yeah.
And so,
yeah.
During my time when I was looking at options, one, I joined the professional sales organization at Temple University. I got an internship as a sales and marketing, doing sales and marketing for basically various product lines, selling T-shirts, etc., just to bolster some type of sales experience. And then I talked to Drew, and I was like, "Yo, Drew, what do you do?" And Drew said, "Hey, I essentially do medical device sales." I'm like, "What the heck's a medical device?" And
what does that mean?
Yeah. And so he went on to explain exactly what it was, right? When you're in a hospital, and because previously I was working at Einstein Medical Center with Dr. John Feely. I was in for physical therapy floor for severe patients. Post-op, I worked in Dr. Scott Goldinger, which was another physical therapy office related to a hospital as well. And so I had this diverse background of experience. And he's like, all the stuff that you see, from MRIs, CT scanners, to implants, to the physical devices in the room, are medical devices.
Yeah.
And I was like, well, how do you get into that? And he goes, well, you got to know somebody.
Right.
And
somebody has to sell that.
Yeah, and so he had educated me on that. And fast forward, I had about 10 job offers coming out of my undergrad. But it was with ADP, it was with Sanofi Pasteur, number of really large organizations. But I really wanted to get into Stryker. The reason why was because I heard Stryker was the most dominant and aggressive medical device company out there.
Yeah, I always said that Stryker is like the Yankees of orthopedics.
They are,
and the industry too. They're up there just overall.
Yeah, and simultaneously, during my undergrad, I did a whole paper for my capstone on brain-computer interfaces and in robotics, and so I was very interested in the direction Stryker was taking with Mako. Mm-hmm. And so with that said, the way I got in is I started pounding LinkedIn, and I wrote everybody. I think I even sent a message to Kevin Lobo, and I was just trying to get in front of somebody. Give me 5 minutes. That's all I need.
Perfect. Dude. So you were like, just need to get in touch with people there and I'll figure it out.
That's
it.
But
let me, hold on. How did you get the job offers straight out of college? Was it the career services department, or were you reaching out to people?
No, I started reaching out to people through my personal network, through LinkedIn, through relationships, such as family and everything. Like
Mm-hmm.
GSK was through a relationship that my dad has. Sanofi Pasteur was through my uncle Joey's a barber, so he knew this woman who worked over at Sanofi, and I met her, and that fast forwarded into a role with them for a pharmaceutical sales job. ADP, I just hunted them down on LinkedIn, and they were giving me 5 minutes, and it was really worthwhile.
Yeah, see, you're a natural networker. That makes sense because I've always seen you in that way when we've worked together, like just someone who connects people. You're asking these questions, and you're kind of, you see it all as a network and how we could all help each other. For
Yeah.
me, I feel like I developed that later, like the value of it. I feel like I kind of did it because I've always known people and like a very friendly person, and I like introducing people. But I've never done it in a business context where I think that clearly, I mean, you were doing it straight out of college, like, and I mean, to get to the position that you are today, it makes sense that that's how you kind of navigated things.
Yeah, it's I think it's in today's world, your resumes are being audited by an AI. If you don't have the correct terminology,
Right.
you're not going to continue to move forward across the pile. And so, in regards and circling back to Stryker, I've met this gentleman. He was a trauma rep out of Stryker. And I just said, "Hey, can I get 5?" And he's like, "Yeah, absolutely. Let's just have a quick conversation." He goes, "If I like you, glad to connect. If not," he goes, "keep trying."
Yeah.
And I'll say his name, Michael Nalbin, because we still keep in touch today. He went to Smith and Nephew, became very high up. He's moved on over to Medtronic now. He's doing extremely well for himself. And today I
Nice.
still talk with him and thank him. But had a conversation in short, kind of pitched myself and said, all I'm trying to do is just get a shot. Just let me talk to a recruiter. And so I spoke to Joni Diener, who you're probably familiar with.
Yeah. 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 She brought
Joni,
me on. Yeah.
yeah. And so spoke with Joni Diener, and she ended up giving me a shot and said, "Look, I really like you. We'll bring you into the Mako product and sales specialist role," which was a role that required 3 years plus experience in the operating room plus experience in sales, which I didn't directly have per
Yeah.
se.
Okay.
But she gave me a shot, and that's how I
So
got in.
why do you think that she gave you a shot, even though you didn't have everything that they were looking for in the position?
Yeah, I think she gave me a shot because what those organizations look for is networking. They look for somebody who's tenacious. They look for somebody who is putting in their all to really be successful and have their why figured out for that role and organization. And I had a
Yeah.
very strong why. I mean,
Right.
throughout the history of my life, it all was around healthcare, technology, robotics, or those alike. And in addition to that, she saw that I had already reached out to other organizations and was like, well, and she had stated that there's a lot of interest in what you're able to bring.
Yeah.
And ultimately, it's not the skill set in selling, it's the fact that you're willing to just go out and get after it.
Yeah. So that's something that I talk about a lot, and it's funny. So we know each other so well. We worked at two different companies, but I have no
Right.
idea how you had gotten to Stryker or got into the field. And then for you to say that, yeah, I approached Stryker. I did all this work by networking until I found someone willing to give me time, give me a shot, put me in touch with the right people. And then I got in front of a recruiter for the organization. And it was very clear that I didn't have everything that they were looking for. However, that's on paper. But you positioned yourself in such a way that they were like, you would be great in this role based on what I'm seeing, based on how you even got in front of me, what I'm looking at, and the way
Right.
you're positioning yourself. And so that's why I try and tell to people, it's like, don't get discouraged because you don't have sales experience. Because I don't know how many times I've heard it, and you probably heard it. It's like, how am I supposed to get in the role? And they want experience, but how can I get experience if I've never been in the role? And I say that it's really a cop out. If you have experience, you're a safer bet to hire. But they're willing to hire people who don't have experience, but they have the tools. So you have to get in front of them to show them, hey, I'm a great candidate. And I want people to be able to understand that you can position yourself correctly if you put in the work. And it's literally exactly what you did. It's, again, not surprised because look at where you are today.
No, and what else I came prepared with is it also comes with a level of preparedness, and that's something you hear and people don't people are like, I know you're bringing that to the table. I went with a 30, 60, 90, a whiteboard, letters from the doctors that I worked with at Einstein, with Dr. John Feely, Dr. Goldinger. I had patients reach out that I've worked with. Not only that, I had other individuals that I was reaching out with following Nalbin to say, hey, I support you. So Jason Nalbin had reached out to say, I support you. And those that I followed up with, I said, hey, look, I have an interview. Would you be okay reaching out and just giving me a support? Can you champion me? And they're like, absolutely, Sal. So I just started to build this foundation around me to say, look, from a character witness perspective, from a level of preparedness and understanding the role of what I'm going to do to impact this, this is how I'm going to prepare. And, not jumping ahead, but I won MVP my first year.
That's excellent.
Yeah. So it was great.
Well, look at it this way. So if you're doing all this work to get in, right? And I'll dive into the 30, 60, 90. I want to touch on that because that's huge. Because what you did was, in short, you stood out. There's 1,000 different resumes coming in. How do you stand out? There's 1,000 different people looking for that job. You made sure you stood out. So you did all this work to get in. And some people might see it as like a burden of all these things I need to do to get in. But in reality, you did all the things that you need to do as if you were in the role to sell something, right? You're going to have to put in that work to sell $1 million robot and have the hospital say, okay, right? So you're treating the interview process or the hiring process as if you're selling yourself to a customer. So in a sense, if you do all the right things throughout the process to get hired, you're essentially you're training yourself to be a good sales rep.
Right.
It goes hand in hand.
Yeah, and it's evidence. It's a paper trail and evidence to just demonstrate what you would do in that role. So I think the way you described it is perfect because, as you know as well as I do, the way that you're winning opportunities is by building champions. Everything is about the clinical champion and establishing equal business stature. And whether that's going to be within trying to find the role and creating a business champion or someone to support you, that's the way to succeed and get in.
Yeah. So the 30, 60, 90. So I have a video course and I also have a webinar that talks about the resume. And the first thing I say is, I'll help you with the resume, that one sheet of paper. But the resume is really, look at it like a portfolio.
Right.
What can you hand them to help you stand out? Obviously, the cover letter, that's something we've been doing for years, right? Then you have the brag book. And the brag book is essentially like a culmination of things that don't fit on your resume, but you want to know this about me. Here are things that I've done, people that I know, recommendations, all these different things that's like, why wouldn't you hire me? Plus the 30, 60, 90, even if it's way off, if it's like, hey, I tried. Right. I don't know exactly how to sell and I don't know how exactly the manager wants me to sell, but based on my research that I did, I Googled some stuff. I asked ChatGPT, if I was selling this product that you guys provide, how do my first 30, 60, 90 look like, right? And here you go. Like I'm making my best attempt here.
Well, and a lot of the way you fact check your 30, 60, 90, and depending on how you want to talk about this, was I had my 30, 60, 90 and showed it to reps. So I validated every step of the process because to me, it was like I can throw some spaghetti or I can find out how the best guys do this. Guys and girls do this. And so that's how I fact checked it. Yeah.
Did anyone coach you through the process? Or was it just, I guess, tidbits here and there?
Drew Domino was a big influence there. And then I constantly would ask people for advice. I mean, just anybody who is high up in a level within an organization, whether it was those that I met from Sanofi or those that I met from ADP, I would constantly have discussions with them on, what's going to be effective in delivering this, kind of my skill set when I don't really have one established. What do you like to see in your sales team? What's going to make them effective? What makes the strongest ASM, area sales manager? And so I start asking those types of questions. How have you succeeded? And we could go down that for a bit because I typically set up a lot of those discussions to ensure that I'm understanding the role holistically. Because at the same time, you're not only selling yourself, but they need to sell themselves to you as a company. Because do you want to work there? Is it a cultural fit?
Correct.
And I've realized as I've gotten older and kind of been through different organizations, culture is actually incredibly important. Typically you look at that and you'll just say it because you'll say it's a push of a button comment. But in reality, it is arguably one of the most important factors to consider, before going into an organization.
Absolutely. Understanding, where, so, okay, if you're a talented person, right, you're not going to be, so to speak, begging for a job. You're going to be wondering, where am I going to be most effective? If I'm
Right.
confident in what I do, I want to make sure that I'm teamed up with the right organization that's going to give me what I need so that I can be effective. Now, that's hard for someone who is straight out of college to have that level of confidence where you have the weight of the world on you. It's like, I have this degree, I've worked, I've been in school for 100 years. Now I'm trying to become an adult. And then
Yeah.
who am I to tell this company, hey, let me see if you're going to, if I want to work for you? It's like, I'll take a job anywhere, right? I need to make some money so I can move out of my parents' house. But in reality, if you do truly value yourself, or at least fake it till you make it, understand that what you need to be doing is having multiple interviews with different companies that are competing with one another. And you walk into the room and you inform them that you're meeting with their competitor as well. Suddenly, you're way more interesting to them, right? Because if I don't hire you, that might mean that you're going to be our competitor someday. So there's
Right.
more, to the conversation. But yeah, and then the other thing that you had mentioned, Drew seems like he was like a mentor to you.
Correct.
And I'm not forcing that on you, but I truly feel like, at least for me, I've been lucky enough to have mentors in my life to get me to where I needed to be, where they are giving you honest feedback. They're helping guide you and they're giving you honest feedback. Now, if I feel like if everybody has a mentor or two, their whole life will change. So making sure that you're seeking out mentors, and the key part is you're seeking them out, because as you get to the ages of 30, 40, 50, it's very rare to find someone who doesn't want to help someone out that's younger, right? And you could see yourself in them, sort of thing. But if that person doesn't want to put in the work or doesn't want the help, they're like, I don't have time for this. But if you see someone who's like, hey, man, I've been doing my research, and what do you think about this? Like, someone older is going to fall in love with that. And it's like, absolutely. You've been doing it. Let me help redirect you in this direction, or let me help put you in touch with so-and-so. And then your life changes. It's like having the right mentors. Drew probably saw that you're, busting your ass to try and get a role. He's more than happy to support you. So that's something that I hope for everyone, but they need to understand it's a give and take. You can't just expect someone to help you out.
Yeah. I mean, you hit the nail on the head. I was this little fire plug. At the end, it was just, I just need someone to jump gasoline on me because I was ready to just go. I mean, in my head, I'm like,
Right.
what do I need? What do I need to do to win? How do I
Yeah.
get this? And so I just put my blindfolds on, and when working with Drew, who was a mentor to me, you just zero in on something, and whatever that person says is,
Right.
as long as it's productive towards the goal, you do it, and you do
Yeah.
it. You don't do it half-assed. You do it 110%. So I think showing that level of support for your mentor, but you also have to challenge your mentor and have really white of the eye conversations. Because a lot of the times, if you're not challenging them, then are you being challenged yourself?
What do you mean by that, challenging them?
So if it's a direction that doesn't seem to make sense with, say, your trajectory, or something that may be against your specific goal, or maybe it's something that may be too easy or a step that may seem too easy, or a challenge that may seem a little off, you want to challenge that. What is
Right.
Just like you would challenge a surgeon in a conversation.
Yeah.
Don't just accept yes in a direction. Understand, identify the target, and then throw, so that you're able to meet that goal. Yeah.
That's true. Just because I respect you and you have more experience than me doesn't mean that your advice is always right.
Correct.
Right. But you having that honest conversation should bring you guys into a closer place where you're able to have an honest conversation with one another.
I think throughout your career in this, especially medical device sales, as you know, you're going to be asked white to the eyes conversations in very critical situations that are incredibly high stress, whether you're in an operating room, whether you're in an executive suite. If you can't handle that and do that yourself and establish equal business stature and show that you can critically think and act on your feet, you're not going to survive in these roles.
Some of the best relationships that I've had with customers, especially hospital administration, is after a really difficult negotiation process, or like disagreements, really getting angry that we didn't lower the price, or they didn't choose us, something like that. Now you have like a history, and we understand one another, and we've been through it, and we've been honest with one another, but we maintain a level of respect. and we're still here and we're still doing our jobs. And then suddenly you have this connection that is undeniable. Like we've been through something together, even though it wasn't pleasant. We've actually been through something together.
Right.
I'm sure you had those
at the end of the day, when was business ever easy?
Yeah.
When are we comfortable talking about our personal or any other finances, right?
Yeah.
It's kind of taboo. So when you're sitting in front of an executive going, what's your net operating profit margin? What's your net income margin? What's your strategic capital look like? What's your procurement process? They don't want to share that. It's uncomfortable. They don't know you from Sam.
Yeah.
You may be the 15th rep that's been in that room that day. And they're just trying to figure out, especially in healthcare, how to keep the lights on.
And then you get to a point where you're literally, with some customers, you can bring that up, or they're coming to you for certain advice. If you position yourself as someone who's honest, right, and you're not trying to, take advantage of your customer, and at the same time position yourself with equal business stature, like we learned, right? Equal business stature, and someone who truly cares for the long term. I'm going to be in this industry maybe in this role, maybe not, but I'm going to be around for a really long time, and I genuinely care. You then become a consultant. You're just like a part of it. Now, at certain times, you're going to have to negotiate. Certain times, they're not going to buy your product or whatever it may be. But there's going to be times where it's like, give me some more insights. But when you first meet a customer, they're holding all, I'm not giving you any of this stuff.
They know why you're there.
Yeah. There's a million and one sales reps out there, right? Why should they trust you?
Correct. And that's establishing a strong, in our case, clinical champion that's going to help soften that blow when you meet them and establish that level of trust and equal business stature when driving up to the executives.
Yeah.
I mean, we could get deeper into that. That's why I'm refraining from
dive in. Well, that's the beauty of it. Like it's a real complex sale. Like if I heard this conversation when I was fresh out of college and looking for a role, this would be so over my head. And I'm like, I don't even know how I can get to a place where I understand what they're talking about and I can do that. But that's the beauty of, I think, medical sales, where it's incredibly complex. But once you get in and you're just shadowing, you're just doing what you need to do for a year or two, then you're in, right? And then you start building relationships, and somebody has to do it, right? So if it's not going to be you, it's going to be somebody else. It might as well be you. If you're a good person and you're doing the right things, it might as well be you dealing with the customer, right? So you're making sure that the right thing happens, that they're getting what they need in a genuine sense.
Yeah, and I had just recently read an article. One of the doctors we actually previously worked with that was with Stryker, and he said there was a sign on his ambulatory surgery center that said reps in the other door with the little red hats and the paper scrubs. And he says how, it's almost being treated as a second-class citizen. And when you further read through it, he had described that how integral a really strong rep can be in the operating room that becomes part of the surgical team, but part of the actual operational workflow. And then he said your superb reps are those that if you leave, it is noticed. And when you're in the room, it is noticed because you provide such critical information and you become such a critical part of the actual surgical team that you're almost employed by the hospital. Yes. And we both have been in those rooms when, Dr. Brad, still a great friend of mine out of a hospital in Virginia. I still talk to him this day, and I had been in many critical situations with him with the system that we were selling that was detrimental to the patient's outcome. And it was definitely a heated discussion, but we were able to work through it. And that's the level that you need to get. But I think that comes with a passion for what you're actually doing. You're not just selling a widget. You're selling something that's going into a patient's body. You need to believe that this is good for this patient. You're making the right moves. You're not doing it for just selling. You're doing it because you truly believe that the triathlon knee was far superior to any other in the market, and here's why. The Mako putting in the system, Mako putting in an implant was far superior, and here's why. And having that level of understanding on a clinical basis that almost where they're resecting. Are they doing parapatellar? Are they going straight through? Why are they resecting this ligament or this tendon? To that level of granularity and understanding is what's going to get you a lot of support and buy-in. That's going to help you develop that level of equal clinical and business stature. Right. And that's what I found as well.
Your ethics and morals are going to be tested, especially, you and I were in the operating rooms and, in the OR and in that space. There's going to be tons of times where your morals and ethics are tested. So you're in this place where you're trying to sell as much as you can and you're trying to get their business, but at the same time, there's a patient at stake, right? So you're going to be put in these positions where, are you making the right decision, right? The simple thing could be like, all right, they've put in your product, you can leave now, or do you want to stick around for a little bit and make sure that everyone's okay, right? Does somebody need help carrying something as simple as that? Or, hey, do you need me to run downstairs to SPD where they clean all the instruments?
Right.
Do you want me to grab that for you? Right? This doesn't help me or my business. And now you could think of it as, well, they're going to like me more. Fine. But genuinely, though, they can tell the difference, right? When they see tons of sales reps and these people are paid hourly in the operating room and they see people come in and out, are you going to become a part of their culture in that hospital, an integral person that you might not be employed, but people like it when you're around? And touching on what you were saying before, so I got in 2011, and at that time, there was a lot of talk about getting rid of sales reps because they make so much money. They're taking up all this space. Our staff can do what they do. All they do is bring in their products and we open up their trays, and then they make their buddy with the doctors, and they leave. You know, not everyone believed that, but there was that mindset. And they expected companies like Smith & Nephew that I started with to reduce the cost of their product if they took over the role of the sales rep. So it's a way for them to save money and not have so many reps in and out of their hospital, right? It's like, let's get rid of these people. But people like Dr. Boyd are like, that's a big mistake. You have no idea what these people do. And no one really appreciates what they do, because when you see them is when they walk in when they're giving a presentation or during the surgery. In order to get everything there and prepared and so that it's ready and so it looks so smooth or easy, like we're doing nothing and we're just like using our laser pointer and like, use that. Yep. Cool. Can you sign here? Good. See you later. The hard work that it takes to do all that. I mean,
It's an upside down pyramid.
That's why the industry hasn't changed. It's almost 15 years later, and there have been experiments throughout the country here and there, and none of them worked out where they try and get rid of a sales rep. So, we are an integral part of it, but we're motivated in a different way. Obviously, it's a choice that we've made, but people don't appreciate what they don't see.
No,
anyways,
it's true.
That's my spiel on it.
No, you mentioned the upside down pyramid. That's how it was described to me by Dr. Boyd. You have everything behind the scenes. I mean, how many nights did both of us stay up till midnight or 1 a.m. in an SPD trying to figure out where our instruments are, where are the trays, did they wash them? We have a 5 a.m. case. We have to get there. You're doing this, and you get called in for a bipolar or a hemi, in the middle of the night, and you're like, well, I'm already here, so I'm going to go cover this case, come back, make sure there's good for the next day. Yeah. Next thing you know, you're on a 16-hour workday. So your trays are aligned. You're in the operating room. You're making sure everything's checked. Is it the right patient? And it's so much setup and so much to get to this one instant. And then when you're in that instance of time, everything slows down. Because now the surgeon comes in, the circulator saying who the patient is, and your head is going 1,000 miles an hour going, is everything in there? Did I fact check this? Do I have the right instrumentation? Did I look at the x-ray beforehand to ensure there's not going to be some subchondral defect or something that's going to impact this case negatively that I'm not prepared for? Do I have the extension of trays that are going to be need for an augment if something were to come through? I mean, you're thinking on so many different levels on the instance of, am I prepared just to start? Am I prepared during this procedure? And what's every contingency plan I have, and have I prepared for those effectively? Because
exactly right.
Once you get to that point, you're thinking, do I have enough implants? Are my trays here? Are my instruments here? Is this the correct type of procedure?
And
we
do
need
it all
for?
with a smile on your face, because everyone's there and they need a calm sales rep, right?
Yep.
So all this is going on in your head, and you're like, don't sweat. We're good. And maybe lean over and shoot a text. Hey, is it on its way?
Yeah.
Is the office sending it? All right, good. We're here.
Yeah. Oh, good. Yeah, everything's fine, sir.
Doc, you're good?
Ma'am.
Okay, cool. And
right.
Are we good here?
Yeah, and it is. It's and you finally breathe, and then you realize that same day you have 6 or 7, and they might be at 3 different hospitals. Maybe you're not in back-to-back total knee procedures. You're at 2 knee procedures, and you got to drive 30 minutes to get to the other hospital, check SPD because you just checked the night before. You're hoping all your trays are in, and that requires not only the level of relationship with the physician, but also the relationship with someone in SPD. You have to build a relationship with the nurses. You have to build a relationship with the executives. And so you have this really this matrix of individuals that have to build trust with you and understand at the end of the day that you're hopefully going to be prepared in every single facility multiple times a day for hours and hours on end. And it's a lot to focus on. Your level of detail preparedness has to be, at a level A plus every single day.
You did such a good job of explaining that, because I try to explain that you're an integral part of your local community. When you're a local territory sales rep or territory manager, where you're out in the field, and you obviously get no pat on the back from anyone. Your pat on the back is your pay, and that's why the pay is good. But the doctors and the hospital have an expectation of you being great and performing and being there when we need you. And the patients will never see you. They never know who you are. The family that's waiting in the lobby has no idea. You give them a glance, but they have no clue who you are. You just got your red hat on, your mask on your face, and you do what you got to do. But you are an integral part, right? There's people right now driving on the highway with trays in their back seat, rushing to another hospital, dropping it off because patient so-and-so might need one thing in that tray. So let's get it sterilized. Right.
Well, I think there's two things to cover on here, and not jumping around, just explaining it, and we'll circle back. One, from an integral part, I remember being in the operating room and a patient, I had listened to what the patient's allergies were. Always typically tried to hone in on that. And it was iodine. And so the nurse was just about to put on Ioband. What's an Ioband? Iodine. And so I was like, wait, hold on. I was like, didn't you say she had an allergy to iodine? And she's like, yes. I'm like, you're about to put on Ioband. And she's like, oh my God, huge. Thank you so much.
Yeah.
And so let's talk about it at a very high level, 30-second, just the state of healthcare. And I'm not going to deviate, but when you're saying the integral part of having a surgical rep in the room, right now, the workforce is the number one challenge, and second to, first to financial. And so with that, what are you seeing? You're seeing capacity issues in the operating room. You're seeing not enough staff to support the needs for the patient. And then if you were to remove the rep, you're going to add more layers onto who? Yeah. Who does that fall on? The ones that are providing direct patient care, who already can barely meet the capacity. You already have a depleted workforce. Your operating margins are completely down because of contract labor and all the other expenses that are going on in the market today. Yeah. What that would create is so much more work for individuals you can't pay more for. Yeah. And so when you look at just the economics of that model, it doesn't make sense.
That's why there's so many people getting paid extra right now, these traveling nurses, and some people demonize them because they're getting paid 2-3 times as much as a normal nurse. But that's the demand right now. There's a lack of, and so they're part of these organizations that are sending them to places. And it's like, look, if you want an extra nurse, this is what it's going to cost. But yeah, that's just one example of the constraints that healthcare, all hospitals are dealing with.
Well, and the reason why it's relevant is because when you're in the operating room and you're that extra set of ears, when somebody's already exhausted, working countless hours under immense amount of pressure, and maybe it's their second year out of nursing school, and the expectation is you have somebody in this room who has 15 years experience in the operating room, the surgical rep. You possibly have a floater, right? A contract nurse who came from Arizona, is working in Pennsylvania. They're not going to understand the hospital. They're not going to understand the politics. And we know there's politics in the operating room. Mm-hmm. They're not going to understand where things are located. Yep. You're not going to get a warm welcome from that hospital staff because they don't know you. And frankly, they typically have a bad taste in their mouths because you're a contractor. They know you're getting paid more for doing the same job, which I've heard time and time again. Yep. And then you have an individual in there with 15 years experience in the operating room, and you need to utilize that experience.
Absolutely.
And so that's the level which you get with these health systems and these hospitals, and the value that you can deliver, not only clinical, but from even understanding the dynamics and the political landscape of these organizations.
100%. The more experience that you have, the more priceless that you and your experiences are. There are certain things that you go through that you've just been through just by being a part of it, whether it's in the OR or a negotiation that you have, people that you've talked to in the industry that you can then, give these little bits of advice, whether it was that patient that didn't get that iodine and that God knows what would have happened to him. But there's something that dawned on me once. I was in an operating room, and we were doing, I think it was just a hip fracture, a basic hip fracture. But I was a young rep, maybe 2 years in, and I was really running around pushing our hip fracture nail. And I realized that I have seen more hip fractures than the doctor who was performing the surgery has done, because that doctor does all sorts of different trauma cases, right? And I am essentially, at that time, I was good at selling like 3 of our lines of products. And the main one, the one that people loved, was the hip fracture nail. And at that point, I could do it with my eyes closed in the back of my head, like like these savants with the Rubik's Cube. You don't even look. Like, I just knew it. And it hit me like, damn, I am valuable. And I was like, maybe 2 years in, I was like, how did I get to this point where I feel way more confident than anybody in this room that have all these degrees and stuff? Not that I know how to perform surgery, but the value that I brought into that room, right, with all these little tricks and how to perform it and how to implant it, it was just like next level. I'm like, damn, I'm just 2 years in.
Well, and how many times, it's a terrific story, have you sat there in the room checking x-rays with physicians and they're asking you questions on, hey, do we need to augment this? Like, what are you thinking, a 6 or a 7 on a knee? You think we need a size 8? What type of clearance do you think we have? It looks like there's a little fracture here. Do you guys have this? And you're like, you have to understand the dimensions of the device. You have to understand how it's going to affect the the anatomy of that patient, but not only that, but mechanical access, right? How that's going to impede movement. And you have all of these factors to consider. So your example of the nail is perfect, because that's the value beyond all the other things we described you bring. Is if you've seen 10,000 fractures, cannot speak. If you had seen 10,000 of those and the physician's only done 2, and that 100%. your experience is invaluable.
They're sweating, and then they're calling in the person that they might sacrifice the better product to make sure that they have the better rep.
100%.
9 out of 10, 10 out of 10 times. Right. And I don't want to dive into the power of the surgeon's decision continues to diminish, right, in our space. But taking a step back, the value that the rep brings is recognized by the surgeons and the staff a lot of the time, especially when they're in a pinch. And then suddenly it's like, who do I have to lean on to have a real conversation? Who can give me advice as to how to get through this situation that I'm in right now? And when you help them through, they'll never forget it. And suddenly you're on another level. Then you're sitting there staring at the x-rays and you're talking to them with it. I remember, 6 months in and watching my senior rep, have these conversations, and they'll never, I can't wait to get to the point where I'm sitting there and we're both like this, discussing the patient and what they need. And it has nothing to do with my product, but just like for the greater good of this patient. Oh yeah, I see that. Did you notice this? It's like, that's where you want to get to.
Yeah, I think I absolutely agree. I would touch on at one point in this call the power still of the physician, but I will wait.
A quick heads up. If you're getting value from this and you want more, check out medsalesblueprint.com. That's my website where I help people get into medical sales. I have tons of resources and tons of content. So whether you want to get in or you want to help someone get in, send them my way. I'm ready to help. You can reach out to me there, or you can also find me on LinkedIn, Twitter, Facebook, and Instagram. Back to the video.
Oh, you froze.
Sorry, you cut out there. I didn't hear it.
I said I do want to touch on at one point in this call, if we get to it, the power of the physician, but I want to ensure that I'm staying on track.
Yeah. No, jump into it. Yeah, please.
Now, I think at this point, right, hospitals are roughly 65 to 70% fixed cost business, right? Your primary revenue drivers that generates the vast amount of your revenue is your operating room, right? Typically that's going to drive like 40% or greater of your revenue overall. You have 5 to 10% from your imaging, diagnostics, and then the rest is ancillary, other things that don't need to be mentioned. But when you look at the challenge that reps occurred is, what's the shift that's occurred, just for transparency in the calls, that there was originally physicians had their own private practices, which means they had the authority to take their business elsewhere.
Right.
Now you're having these large hospital systems purchase up the large physician groups. We're seeing it all across the market today.
Yep.
And so with that, there is a feel of loss of leverage.
Yep.
However, you still have to recognize and just improve your level of understanding of the operating room's economics to be able to justify the purpose and direction that you're leading your champion to the executive team for the sale.
Correct.
Because if you understand that every minute in an OR for an orthopedic case is $56.08, well, now you can say, so every minute of operating loss in this OR is X, Y, and Z. Here's instance of downtime. here's the revenue generated for this specific procedure for the OR, and here's the return on investment, et cetera, for the physical hospital.
Yeah.
Now you're having a conversation where it empowers the physician not only to understand the economics, which we know they typically don't understand, but
Right.
that's going to help empower them to get to the executives and feel a level of confidence. So I think we did lose a bit of that edge of saying, like, hey, take your business elsewhere.
Yeah.
But was that necessarily the appropriate way to do business at the time? I think you just have to have a better business acumen to be really effective at selling in the operating room than we did in the past.
Yeah. Truly understanding beyond your product. When you're putting in the work to understand what's going on beyond what you provide and what's going on, or what you care about what's going on around you, whether it's the physician's practice, the hospital that you're dealing with and what they're going through, and doing your research, right? And having these sorts of conversations, making sure when you go to these conferences along with a doctor, you're actually sitting in when you can, so you can learn when people are presenting, and so that you can have these conversations beyond your product, right? You're just trying to sell your $1,500 widget or $5,000 widget or device, this implant. But when you know about the numbers and what they're dealing with, and what's on the forefront, what are we forecasting? What does the hospital intend to be doing? You drive it in that direction. Then you can be more supportive, and people will actually care. And to your point, you can help educate the physician on what he needs to be saying, so that, because you and I have both seen it. The physician will go up to the, whoever, director of the OR or whoever it is, and is like, I need this. And they're viewed as throwing just a temper tantrum because Dr. So-and-so just wants it. It's just that he's not speaking the language that he needs to be speaking to these people, so that they understand why he needs it. He just wants it because he likes his rep, or, he thinks that metal is cool. It's like, no, there's an actual reason behind it. My surgeries will reduce by 30 minutes, and that's X amount of dollars per case, and we could fit in another surgery, as opposed to, I'm doing 5 right now. If I start using this, I can now do 6 a day. That's, $50,000 extra revenue, XYZ. Now we're talking. Now people will listen, like, oh, okay, let's sit down and hash this out. And if you're providing them with those numbers, with the charts and graphs, or speaking on their behalf, whatever it may be, great. So, to your point, yes, hospitals are, healthcare systems are buying these physician practices. As these physicians age out, a lot of them are going, you know what, I'm just going to sell it off. I make my millions for working so hard, and I'm going to go to Cabo and chill out, or Turks and Caicos. There's also, in the last 10, 15 years, there's been a lot of people, surgeons or doctors coming out. They have so much debt, hundreds of thousands of dollars of debt. And these hospitals like, I'll just employ you. Here's $250,000 a year and XYZ benefits. And I'm like, okay, that means I'll pay off my debt within the next X amount of years, and I can drive my Porsche because I deserve it, because I've been in school for the last 40 freaking years. All right. Now, by doing that, you have no say, because you're just an employee of the facility. You can't say, I don't like this. The way you guys are running this hospital is crap. I'm going to this hospital unless you get it together. It's like, no, you just signed a contract. Like, you have to stay here for the next 5 years, and this is what you're getting paid. So as a sales rep, understanding these different dynamics, you can approach it differently. Completely agree. I think you and I got a serious crash course in that when we were selling those robots. So we had to.
Yeah. Yeah, it's important to know all the dynamics. But God, you're about to ask something.
Yeah. Shifting to, well, that was a lot. That was good.
That's great.
I'm supposed to talk and be just like, I don't know what you did.
No, like I said in the email, dude, I was like, if we just have a conversation like we normally do, where we just start like going on rants about the industry and certain things, and
Yeah. At the end, I think the goal too is that you wanted people to know how to get in.
Well, yeah, so that's what the business is focused on, and I want to help. I think there's so many people that are talented that don't know where to begin, don't know where to start, or they get a wrong idea, and then they just don't know how to position themselves. I just want help. I want to help people understand what it is they're getting into, so that they can go after roles like you and I are talking about, specifically operating room. I mean, we were in orthopedics, but we're talking about the operating room. There's so many other things we can sell. Like you just said, MRI, large capital equipment. You can be a pharma sales rep and just go to the doctor's offices and provide not just drugs. You know, people think that pharma reps just sell drugs, but they also sell other, I guess you could say, devices or therapies that are being used in offices, right? And that dictates your lifestyle. I want these people to understand what's out there beyond, oh, I heard you get paid well. I think you sell to doctors and, you know, it seemed like you're well put together. You know, good for you. How do I do that? There's way more beyond it. I'll give you the background information. And then it's all about positioning yourself so that you can get in. I don't think you need a crash course on how to be a good sales rep in order to get a job. I think you need to understand what are they looking for, and so you can position yourself in that way. And then, you know, your first 6 months to 2 years, you're going to be shadowing and learning. And then next thing you know, the weight of the world is on. You got your own territory and you're making a lot of money, hopefully.
Yeah. Yeah, I think.
Do you agree with that?
I do. I'm just thinking through like my recent change. And I'll take a pause because I don't know when you're going to post this, so don't post it. I'll tell you when. But
I won't.
The recent change, you know, I was fortunate enough that they knew Mike Morawski, they knew Chris Dunn, right? They knew the animals that used to work at Intuitive, but not only that, yeah, I know everyone's
animals in a good way. Animals as in like they kill it, like they go hunt and they know how to sell. These guys know what they're doing.
Absolute beasts. No, I think one of the big things from there was that I did know somebody, but I got in through, I just applied, but it wasn't enough to just apply. When I applied, and you talked about this way earlier, I had my resume, professional case studies, which is kind of that one page you talked about on where your successes are. I wrote them out as a consultant did. And I learned that when I was interviewing with BCG. And so you wrote them out with your STAR method, which was exactly what they were looking for. So if you want to specify your resume, quantify everything and why it mattered. And then I had whiteboard, I had a 30, 60, 90, I had all that, but that wasn't enough. What I ended up doing.
So tell me, on the resume, you went STAR method, right?
Yeah.
Because in the interview, I believe in STAR method. I'm not a big fan of the acronyms, but if there's one acronym in terms of the interview process, STAR is the way to go. It makes complete sense.
Especially
but you're saying
sales.
You applied it to your resume.
The entirety of my resume.
Okay.
Essentially, the way my resume was broken down was just really a very short 2-sentence of what this role is.
Mm-hmm.
Title, what the role actually is. Just straight and forward. You know, as concise as you can be. Under that was a few bullet points on what I physically did outside of that role. Because you could say, hey, I was in, you know, if you could say, hey, I was a sales rep, I sold to surgeons. Great. That doesn't really quantify or establish a basis of what you did. Yeah, sure, you sold to surgeons, but that's the job requirement. So it was, I sold to this specific market. My result, which I would put in a sub bullet down there, was very high level. This was my result. Was I sold to Dr. X, Y, and Z, which increased his business by Y, and this was the ultimate result. And so within that professional case study sheet that I also shared, I went into greater detail on certain experiences, which was the situation, the task, et cetera, et cetera. And so that's how I broke it out to provide emphasis on those experiences. And within the resume, it was just a very high level, but the result was shown for every single bullet point that I shared on there.
Yes. So I 100% agree. It needs to be very short and sweet in terms of responsibilities, right? Not everything you did day in and day out, but my responsibilities were this. My expectations were this, if you want to add to the responsibilities portion. And then objectively, here's where I succeeded, because it's a sales role. So it has to be like a sales resume where it's not like, the manager was really appreciative of me, and so he hired. No, like, stop with those words and say, I tripled our territory's revenue within 2 years. Boom, objective success that a sales manager will read and go, okay, I understand that you help grow territories, right? I reduced the excess spending on our whatever it may be. So it has to be objective numbers, objective successes. And a lot of people who aren't in sales roles are like, how am I going to do that? I'm like, actually, if you sit and think about it for a minute, you know, what have you done? And then turn it into some sort of numerical, if possible, win that you had, or even if it's double or a 70% increase, however it may be. So sorry, go ahead, but 100% agree.
But that was essentially the breakout. And those that stood out to you that you felt were really effective, I have 4 examples in my professional case studies document that are diverse. Because I wanted to show that I can, beyond selling, I have other skill sets that could be applied that are relevant within the healthcare space. And so but to your point about those that are coming in with experience that's not in sales, some of them aren't sales related at all. One is a project I did with Medtronic during graduate school at Georgetown. And it was about helping transform their strategy to get into value-based healthcare and within a certain market across overseas. And so
what do you think they're seeing when they see that on your case studies?
I think they're seeing, one, you have other interests, right? No one just wants a robot.
Yeah.
I think also it's that you have the aptitude and understanding and interest within your specific space, but you're able to apply what you've learned, the level of intelligence you have on a certain topic, into other avenues of business.
Yeah.
Because as we described this entire time, this is a very dynamic business. You have to understand clinical. You have to understand the physical business and economics of the operating cells, but you also have to understand the market. Right. How, like right now, if Medicaid was to go through, et cetera, that's going to have a negative impact on rural healthcare centers, but ultimately payer mix, as an example goes. So how in the future can we start thinking of, when we're working with these hospitals, how this is going to impact them? So you have to have so many understandings of the business as a whole that I think that those examples, which were called out in my interview, they liked them and we talked about them, had demonstrated just really the varying success that can be applied just simply from your understanding, your business acumen, and level of interest within a certain area.
Yeah. Yeah. When I would interview, and a lot of the people that I interview had very little sales experience, maybe no sales experience at all. I was hiring a lot of associates to join my team. So a little different than your resume and the way it would look, right, with the experiences that you have. However, first things first, when people look at a resume, they look at it from 6 to 10 seconds. So it can't be an overwhelming abundance of words, right? It's not your life story or your story of your last 5 years at this company. It needs to be like just how we said, but then they're going to go through it and you have to be prepared. You're inviting them to ask you about these moments in your life,
right,
and be prepared to express it in the way that they will be interested in hearing it, right? So you went to Georgetown. Yes, which I want to touch on. You took advantage of what this multi-billion-dollar sales organization offered, which was to pay for your degree, right? Right.
Correct.
You positioned yourself in such a way in that organization to take advantage of that. And you put in the work, and now you have an extra degree. I'm curious about that, but I don't know if you want to talk about that now or later to divert from the resume. But that's,
I'd say whichever's relevant. I think sticking to the resume, it's a builder, but whatever's relevant.
No, let's go to let's stick with the resume, and we'll talk about that later. But please continue.
No. So,
case study.
Yeah. So essentially, broke it out that way. To your point about 6 to 7 seconds, during the discussion that I have and have had in all my interviews and my most recent interviews, no one dialed into the bullet points of what the role was. It was all the success. So Sal, I saw here at this, there was zero business in this area for 3 years. You grew from $0 to 18 million. Talk to me about how you did that. What were your toughest challenges during that? How did you initially approach the business to identify key opportunities? Who did you identify as a mentor? So every time that they saw the successes, they related it all to those key result points. Because really, what do people care about? Success.
Yeah.
You're not hiring somebody because they've done a role. Did they succeed? Yeah. How did they succeed? Where did they just succeed? What did they do to succeed? And what does success mean to them and the organization? And that was essentially what was called out on my resume every single time that I had discussions. And wholly, that's what they cared about. Other than that, it was just really my personality. What was I interested in? Why am I a cultural fit? But from a resume perspective, that's what they cared about. I think in addition to that, the other thing too is when I built out my whiteboard, and I put some on my resume, was I said I played rugby, I love to snowboard, all of that. Yeah. And so they'd be like, oh, you're an Eagles fan, you just won the Super Bowl. And it's like, all right, right. And so even they want to humanize it too. You don't want to be a robot.
Yeah. Have opportunities to get to know you, build some rapport, see what it's like to chat with you. Because, you've done all these impressive things, but You don't want to seem like a robot, and so you need to get along with these people. And the other thing is every single hiring manager or sales manager, which are the hiring managers, they have quotas to hit, right? They have their goals, first off, they're not getting fired, right? So they need to hire someone that's going to be successful. They want to hit their number. They want to walk across the stage at their sales meeting, their annual sales meeting, and get an award for getting all their sales reps to quota and go on their grand champions trip. They have a mortgage and they are putting a kid through college and they want to buy a boat. They have all these goals. So, right, they have their life going on. Are you going to make my team more successful? Can I rely on you to hit your quota? That's number one. That's why we're putting objective successes. So show me that you've been successful in whatever it is that you've done. Show me that you're going to be a cultural fit. Show me that you're an interesting person. Show me that you're going to get along with these people. Show me that you're not going to be a headache. Show me that you're going to actually stick around for a while.
And I'll pause on cultural fit there. That was in my most recent conversation. And with Stryker as well, I sat down when we went to the VPs for our final decision, and they say the whole conversation, they're like, look, I already know you've been vetted. You've already went through 1,000 interviews, a panel discussion, a case study. We know all this. And I had sat down and she said, tell me about yourself and why you'd be a cultural fit. Because culture was so important to her. So important to the point where if I didn't get past her level, I did everything. I've had 8 different people call her from the company. I had all these, shared all the accolades. I did everything, right? To the point where I was in the interview and they said, which territory do you want? There was 5 open. But I got to her and all she cared about was, are you a cultural fit? Yes or no? Why would you fit here? Because her initiatives were changing the culture. And I think when you look at the level of intensities that these roles really offer to you and your family, the level of opportunity, and that's why I use the word offer, you have to be prepared for what's to come. These are not easy roles. You are working hard. You are under a lot of pressure to succeed, not only in the operating room selling, but hitting quota, but you also need to succeed with your family, right? That's the most important thing. And so how are you managing that work-life balance? And that was her concern.
Interesting. That's why. So I could make a lot of assumptions. First off, I think it's intelligent of her you're bringing a human onto this team,
right? And
she has her initiatives. How did you find out that her reason behind wanting to be a cultural fit? Did she offer that up, or did you ask?
I asked. It was one of my questions because it was really important to me. Honestly, it's something I miss, Pedro. I miss the Stryker mentality. I miss being around a bunch of type A, go-getter individuals that operated like a family. Yeah. I miss the entirety of it. I miss the level of, say, pressure, to simplify it. But I miss overall that culture, and I had no idea that I would ever miss that.
Yeah.
Because it's so intense.
I know what you mean. But then you leave it, you go to another organization that doesn't have that sort of culture.
And there's nothing wrong with that.
No.
There's a different mix for everybody, and it's a culture that I miss. And they hire a lot of athletes. They hire a lot of people that want to win, that are used to operating that team environment, that are go-getters, that they're setting goals. And it's not like other companies don't do that.
Yeah.
It's a different dynamic. And so she wanted to understand that. And I said, look, what's important to me is culture. I've heard about this organization's culture. I've heard how challenging it is, but I also recognize it's what I'm interested in. What does that currently look like today? And how are you transforming that for the next 5 years?
Yeah.
And she loved the question. And we talked about it for a good 30 minutes of the hour plus conversation.
I love that. Because you're absolutely right. And it takes a while to understand that the different types of cultures and figuring out what kind of culture do I thrive in? What do I like? I always thought when I was with Stryker, I thought it was funny when you would tell people you were Stryker, and sometimes you would get the response, "Oh, they really care about quota there." And I'm like, "Does your company not? Like, don't you have like a minimum you need to hit? Like, you just going around selling for fun? Like, there's goals there, right?" And then leaving Stryker, going to another company, and evaluating all 4 different companies that I work for, the major companies I work for, they all did look at it differently. They all had their own ways of setting goals and expectations, right? And the way they kept their people. There's people that go to an organization like Stryker and will not thrive because it's too much pressure. And when you put that immense level of pressure, it's just not for them. And I don't think that they're weak or not good enough. It's just like, they have their mode, their speed, and the way they want to be spoken to, or the expectations that are set. And then there's others that are like, they want the coach in their face telling them, hey man, you need to do better. You got to score there, or whatever it is. And that's kind of like more of what it feels like. Not that anyone's ever in your face at Stryker like that, but there's an expectation, or you're looking around and you're like, I want to be on stage next year. Like I should have gotten that award,
right.
Where there's where it's like more of a team atmosphere, a cultural fit, things like that. The other thing I wanted to say is, when I first started, people would say culture. I went to school for business, and I still never really understood what culture means. Like, what's the difference between this culture and that culture, and how do you get to that point? And then it hit me. Somebody had said, and I think I was watching a podcast, and they said, setting a culture is when you set expectations of what's allowed and what's not allowed, what's okay and what's not okay. The culture will stem from there. When the leaders, when they say what they want and when they say what they don't want, but really, when someone says something or acts a certain way or makes a decision, and leadership, either they say nothing, meaning they're okay with it, suddenly everyone's going to see that and subconsciously go, that is acceptable. Or someone makes a decision or says something and the leader goes, and they respond in a certain way. Maybe it's like, that is completely unacceptable here. Everyone now knows that that is completely unacceptable. Or, they say it in a polite kind of way, or maybe they pull you in the other room. Like the way you handle these situations, leadership, I don't know if leadership truly, some of these leaders, a lot of them do understand. Some of these leaders don't understand the impact that they have on their organization with their responses or lack of response to when people just say or do things. And that's what creates the culture in these different organizations. When I learned that, I was like, oh my God, I looked back at everything and I was like, that's why this company is like this. That's why this company is like this. That's why the subculture in this branch in this city is different than the culture in that city, because of what's acceptable and what's not, what the consequences are for doing these certain things, and or lack of consequences for these activities.
Yeah, I think when I look at it in kind of the way that I envision it, just easy way for me to describe it, it's almost like a crew team, right? A culture is somebody, the leader, who is helping everybody row the same way, right? As long as everybody is rowing the same way with the same cadence, that's a really strong culture. Why? Because everyone has equal belief and is putting about equal amount of effort to succeed. When you have somebody who is a loss at that culture, then you have someone who's maybe not rowing as well as the others. Maybe they're rowing the wrong direction. And if they're not comfortable with that cadence, with that pace, with that level of whatever that team and fit is, then they're not meant to be in that boat. And I kind of look at it from that perspective and simplify it in the sense that we're all rowing the same direction, and you're doing it to win together. And so that's just as simple as I can put it, not trying to be philosophical or what have you.
No.
But I do look at it from there, because I want to be in the boat with the girls and the guys that are all rowing the same way, with the same level of intensity, with the same level of guidance, and we're all working together to achieve the same goal, and we're all pushing each other to do so. Yeah.
That's the culture. That's the culture that I think most people want to be a part of, where they're supportive, right? And when people don't feel like they don't have, there's a team atmosphere. When they don't feel like they have a team, when they don't feel like they have a friend, when they don't feel like they have the support, then it's like you're on an island. And I think it's just a ticking clock until you're like, I can't take this anymore. Until someone on LinkedIn messages you and say, hey, there's a job available here. And you're like, you know what? What am I doing here? I have no support. I have no friend. I have no team culture, or they say it's your manager. They say most people leave because of their manager. I kind of believe that, but it's also the people around them. But the manager dictates, right, if there should be a team culture or not. You remember Matt, my old manager, he would stand up in our quarterly meetings when people would present. They would present the deal. And if they put the wrong date on the slide, he would stand up and be like, the next person who has a typo on their 5-slide presentation is going to sit right down. That's the last time this happens. And you look around and some people are like, geez, dude, it's just a freaking date. Like, it's just us, right? And then he's trying to set a culture of excellence. It's like we are supposed to be the best sales reps in this company, right? And we walk around like we are. And how are we supposed to be the best if we can't even get the date right? Right? And then he's also like, as your manager, how do I think your presentation decks look to your customers when these are the people who sign your checks? Like, we are your managers making sure you do a good job. So those are the little decisions. Or I've been in organizations where people are presenting, and you've been a part of them too, where certain people in the room will stand up and say, hey, that's not acceptable. And there's certain people in the room that are like, they just let it go. And it's like, if you continue to let that slip, then where's your organization going? Where's your team going? Do you expect to hit your quota? It's a little thing. So I digress, but those are just some examples that you and I have shared. And I'm not trying to bash anybody, but
I don't think you are. I think it's cultures beyond just, hey, are you being friendly to me? Right. It's really that. Is it level setting with everybody, being able to have constructive and constructive criticism and whites of the eyes discussions? And is this individual going to be offended, or are they going to take that constructive criticism and say, yeah, I need to do better. Thank you for that.
Yeah.
And that's the environment you're going to be in a medical device. Constructive criticism is going to be in your face. And I welcome it every single day. Whether you like it or not, you're going to get it.
I want to I have a specific question around the case studies. How are we doing on time?
Yeah. I'm fried out of my computer, so I can chat.
Cool.
I know you're not going to take all of this. You're going to snip and dip and whatever, but I literally can't get in.
That's wild.
It's crazy. Well, it's because I moved.
The case studies. You didn't put case studies in your resume, right? Did they request case studies, or did you choose to come up with 4 and have them ready on individual papers?
I chose to come up with 4, and it's on one sheet of paper.
Okay.
And so I chose the 4 because I felt they showed diversity in my business acumen and my interests, and also shedded some light where you otherwise can on a 2-page resume.
Yeah. Yeah.
Because
yeah. Go ahead.
No. It's just if everybody's sending a resume, how do you differentiate yourself?
You want to stand out, right? So that's the case studies I feel should be in the brag book. I wanted to make sure that it wasn't like something that was put on your resume. And another thing is, someone who's been in the industry as long as you and has had the experience that you have, your resume is 2 pages, right? You have to have an understanding of whether or not you should trying to be getting to 2 pages. If, let's say, your resume is a page and a couple lines, and then you want to get to 2, it's like you probably should pull back. If you're in a position where you're going for these higher level roles and you've been in the industry for quite a while, then it makes sense for you to have a 2-page resume. But also, not just your cover letter, but your brag book that speaks to all of the experiences that you've had. When I went over to Siemens, they wanted to see a full-on list of all the relationships that I had in the territory. I went ahead and created an Excel sheet, 2 pages, and I put more on it than probably needed. I still made it clean. Actually took a really long time to figure out how can I make this clean but insanely informative to give them a full understanding of what I can offer in terms of relationships. And they love that. I mean, they poured over it. I think what a lot of people might be thinking who don't have sales experience or medical sales experience is like, what is going in my brag book? And I think case studies is a great idea, especially someone who said, I had 4, and one of them had nothing to do with medical sales at all, right? It's just a study. It's just tell me if I'm wrong. It's an example of a choice that I've made, something that I've gone through, something that I've done in my life that gives you a good representation and understanding of who I am, what I choose to do. And I welcome you to open up the conversation about it so we can dive in and I can share more with you about me and who I am. Right?
Agreed.
Yeah. Huge.
Yeah, I've inundated them with materials. Inundated. I sent them that document. We created the deal rip
Yeah, yeah.
PowerPoint on
Okay.
educating and everything. I shared that with them to show sales process because that's always a question to be asked. A lot of times I send things where I know it's going to be a question in the interview that's going to be too much. It's a question that it doesn't necessarily need the answer. It can be sent beforehand. So
Yeah.
what you should talk to, this is the one we always get, talking about your sales process. Well, I'm just going to send them what my sales process is so we can have a deeper conversation about how I applied it.
Yeah. Yeah.
And so I did send that over as well.
I think that's insanely important for someone who's going into a role where they immediately have a quota and they have their own territory, right? Because they're taking a big risk by not hiring one of their own, a homegrown guy who knows the company and knows it. And now let's give them a shot to actually have their own territory versus what's the pros and cons of bringing someone from outside the organization they've sold before, but are they really going to blend? Not just culturally, but like the way in which they sell, right? Is it this process in which we do it? So that's perfect. It's not something that's going to be presented for an associate. It's going to be someone who's going from a sales role into a medical sales role where they might have a territory. It's like, this is how I go about my sales. That's perfect. Yeah.
Yeah. I mean, not even necessarily. I mean, you could do it as an associate. You could come in and say, I spoke to all of these sellers within the organization, which will one demonstrate you've talked to people, you've got them to vouch for you, but I also had them explain their sales process. And here's how I would apply it, and here's what I learned. So what I did on my whiteboard, and I'm not sure if you're familiar with whiteboard, but what I did on my whiteboard was essentially I found the number one reps in Intuitive. I guess I could say that.
Okay.
And I found them on LinkedIn. No idea who they were. I just looked up the years of experience. And frankly, if you could survive at that company more than 3 years, you're doing something right. And so I found those that were really effective. I spoke with the managers and said, who is the number one rep here? I said, et cetera, had those discussions. And what I took from that was I asked them all the same questions because I was trying to lead to what's the average. And so I've had a very simple slide. Here's who I spoke with their level of experience next to it. And the box next to it was, these are the 3 things I heard the most successful people do in this organization.
Mm.
And so when we talk about mentioning whether it's sales process, whether it is what the most successful people do, I validated sales process with them. They're like, sounds like you know exactly what we're doing. Or they tweaked it. Hey, we do this type of sales process.
Right.
And here's where I would add a point because this is different now because of a cultural change or because of a market dynamic. Great. Let me insert that. How have you applied that? And then from understanding the 3 average points, it's always do you have the attributes or can you describe in a interview what you learned about those attributes and how you've already applied them in your current day? If you don't have experience in that, then how would you apply those and share some examples? But that's what I applied in my whiteboard, which my whiteboard was about 9 slides.
Okay. So tell me more about the whiteboard. Is that the webwhiteboard.com? No.
No. I can share my screen and show you if I can actually get into it. I don't know if I'm allowed to, but I can just show you. I'll show you. Hold on. Actually, can I pull? I know I might have deleted it. Let me see. Actually, no, it's in my email. I don't know if you're going to post that. I don't know. I wouldn't post though.
No, right. Whatever. This is not going out for a while. So, and I'll send you exactly what we'll be looking to post. So
yeah, perfect. Yeah, let me pull it up. Cool. So okay, perfect. Now how do you share on this?
Should be on the bottom.
Okay. I didn't even know. I'm so used to Teams.
Yeah.
Screen. Does it say
this app is great. It does so many different things.
Does it say which screen? Select tab. Aha, there it is. All right, can you see my screen?
I can, yeah.
All right. So where I learned about this was I was speaking with the reps, and they're like, "Hey Sal, do you put together a whiteboard?" And I was like, "What the heck is a whiteboard?" And so what a whiteboard is essentially this, like what's your background? Education, 3069, pipeline management, like white space, essentially who are you as a skinny that you can send to them ahead of time. So background, et cetera, what I'm interested in, all that stuff. Because you want to humanize yourself. Yeah, you want to humanize yourself. DNA. So this is what I feel that are my key attributes to succeed. Why the ASM role? So I felt I was a cultural fit, turnkey, situational leadership expert. And situational leadership expert is leading without authority, because that's what you have to do, especially selling a med device in capital. You have to get the clinical team on board, or the joint team, and you have to get them comfortable meeting your surgeons and then getting that surgeon to champion them up to the executive. So that's what I meant by there. So that's what I put. This is the individuals I spoke with, which I actually need to add to this list because I spoke with more, but I'm already kind of forward with that. But these were the 3 things that they stated were keys to their success. And as you know,
1, 2, 3, 4, 5, 6, 7 people.
And I spoke more to 7. I spoke to about 12. Because as I learned more people, I went and talked to them. The training's cast. It's 3 months long and it's rigorous. A lot of people fail out. It's like Mako training where you have to get a 90% on every exam.
Yeah.
3 months I have to be in training.
This is for the sales reps or for the doctors? Oh, this is for to be a rep.
The sales reps and the clinical reps. I'm in there. We're doing the same training.
I love that. See, we didn't have to do that with our company, where it was the product specialists that were managing the machine needed to pass an exam in order to be proficient enough or acceptable to then manage the machine in the operating room.
Right.
For you guys, as the sales reps, you need to pass the same thing.
The same
Makes
thing.
complete sense. So there's no disconnect. You know 100% how that machine works. You could operate it yourself if you needed to.
Right.
To a degree. To an extent.
To an extent.
Right.
The other thing I was going to say, jumping into this, but this was my 30, 60, 90, kept it pretty clean. Then pipeline management. So this is the way they sell. A 6 is a nuance because of what I was added to it. And then, me, how I'm a big nerd with Excel and identifying opportunities. Yep. I did a whole white space analysis on the territory to identify where the open opportunities were. So that I explained to them, I said, look, with my 30, 60, 90, my sales process plus the white space analysis, I already know where all your systems are installed. I already know the complexity of the 52 IDNs, and I already know where there's opportunities for greenfield expansion. I was like, day 1, I'm turnkey. Right. I already know where all your stuff is. So
yeah. And I'm sure they have a whole bunch of software systems that tell them that. And you're like, I don't even need your systems. I know exactly where to go. I have access. If there's anybody that knows websites that will give you the information needed so that you can target customers, it's you. For sure.
I know. So that was the, this was the
That's
whiteboard.
Excellent.
Yeah.
This is huge.
Yeah.
And this is the stuff that I'm sure they were drooling over, right? I mean, that's what I imagine. It made it hard for them to think about any other candidate, right? It's like, give them a reason, like try and say no to someone who presents this.
Now you're back.
How do you say no to someone
I think it shows you a level of prepared. I pulled it off. Yeah, I think it showed a level of, I could show you, I mean, I don't know if you care. I could show you all the stuff I sent.
By all means. I mean, when I was naming my resume, like video module, course, I have to name it resume because most people think resume, but in reality, it's your portfolio. How do you develop your portfolio, what you're presenting to them?
Yeah, this was my case studies.
Yeah.
Broke it out. Key highlights, just giving you like boom, boom, boom.
Hold on. Can I see the case studies?
Oh, yeah. Sorry. I thought I had
You're good. No. You're good. Case study 1, strategic leadership in healthcare infrastructure, transitioning value-based care, client engagement, marketing expansion in healthcare robotics. And you're speaking their language, right?
Yeah.
Expanding Stryker's market presence by building client relationships and educating surgeons on robotic systems. Yeah. Okay, cool.
Yeah. Then closing, and then I go through each.
Yep. Results. Achieve 12%, 16%, and 30% increase in order intake across target branches, generating over $5 million in new business. period. The framework was expanded across other branches nationwide, and the healthcare business exceeded performance goals by a wide margin.
Yeah, and so like from Siemens now, we're expanding what we've done. We're working with the national healthcare sales managers and expanding what we're doing because they want to scale it, but it's really hard.
Yeah.
But yeah, so this is it. Just kind of, and this one has nothing to do with selling.
South Korea market dynamics. Right. Yeah, so this shows your dynamic background, like the experience that you had in South Korea. I was jealous when you went there. That was awesome.
It was dope, man. It was too hot, but it was dope.
Wait a minute. Also to determine. So you have project overview. You showed your challenges, the strategy and execution to overcome these challenges, and then the results. Effectively, you're showing them what they're buying. If we go ahead and buy you, right? We buy Sal Sulimay. What are we getting here? We're getting a guy who has, and then you show him your results.
Yep.
Yeah.
Yeah. So.
Excellent.
Yeah.
I like this one.
This one's relevant. And then so I called it out here. This is what I said.
Where? Which part?
It was down here.
I successfully grew the territory. Oh, the bottom. Developed and grew doctor business from performing 100 procedures per year to 1,000 joint procedures annually, equating to 4.2 million in net new business. No wonder Doctor loves you.
But that was like, yeah. So this is what I broke out. Anyway, just showing you it. I don't know what you can use, but this is this is what I provided them. I gave them the whiteboard, resume, professional case studies, letter from Steve Wagman for grad school, and then the white space analysis.
I just want to point out something there that you put. So you could have put, I sold a robot to Doctor for $1.3 million after working really hard. No, I helped Doctor increase his procedures by X, and the revenue generated was X for Doctor and the location, who are now looking at what you've done, which is you sold a robot. That bullet point is I sold a robot. But you're looking at it from the perspective of what have I contributed, right? And I'm sure that the customer and doctor in the hospital who made the purchase or whomever it is, they made that purchase because you sold them on this idea, right? Not, I have a really good robot. Look at the way the arm moves and the way it modulates and the XYZ, like features and benefits. You got to get, what are we buying here? What is the outcome?
Right.
That's huge. That's the difference.
And so I just showed you all that. I just to show like that I sent so much stuff over and I prepared so much to demonstrate that I was the right fit to the role. There's only 33 in the company. And so I was like, I want this, and that's what I ended up providing them. So there's like, just for however you're putting these together, they love the professional case studies. They love the whiteboard. And they love the white space analysis. My resume was more of like, oh, cool. Yeah. They didn't really care, but they're like, that great, wonderful. Let's talk about these things that you sent us.
Yeah. Resume is ATS system, and what roles and what positions were you in? And then especially with someone with your background, there's so much more beyond it, right?
Yeah.
And you're hitting what they're looking for, what they're interested in. So love that.
Yeah. Great. Sorry, we started shooting the shit and showing stuff.
No, it's been great. And I've been taking some notes too, because we're working on obviously tons of ideas on what we can share with people with content and just visuals and everything. So it's been really great seeing like everything that you've done and all of your ideas and how you've really just taken it in your own hands and created a foundation and organized your thoughts and been able to showcase everything that you've done in such an organized way. It's super, super helpful for us to see that so that we can inform people that there are other ways to showcase your skills. It's not all about just the resume and the bullet points and all of that. So it's totally in alignment with what we're doing. I really appreciate it.
Yeah,
Yeah,
of course.
been
I'm
great.
happy to just share all of it. Thank you.
Yeah.
Thank you. I appreciate that. Yeah, and I could share, I could share this all with you guys though.
Yeah, no, thank you.
Yeah.
So what we're doing is we're also providing examples and templates of what it is we mean when we say building a portfolio and
Yeah, I'll
offering a
just
case study. So we're the fact that you're doing it is great, and then we can build some like basic generic blank documents that will go along with the education. What I want to ask is, what is one piece of advice that you'd leave with someone who is considering getting into medical sales or in the process of going to try and get a job in medical sales?
one piece of advice I'd leave with them.
Yeah.
I guess one piece of advice, if they're trying to get into medical sales,
Mm-hmm.
it's connect. Be intentional about your connections. Not sending a resume, not just not just shooting and applying to a job on LinkedIn, not just reaching out to people randomly, right?
Mm-hmm.
What I learned over this time was being intentional about reaching out and connecting with the right people. When I did it at Stryker, I didn't know anybody. So I just went after everybody I possibly could. How could I improve that? And how have I improved that in the future? And just today, with Intuitive Surgical, I found the best individuals there.
Mm-hmm.
I then asked them, who else should I speak with? Who else to answer these questions should I speak with? And with that, every single person I spoke with in those conversations, at the end, I said, after our discussion today, are there any questions for me that would help you feel more comfortable reaching out to my manager and saying that I'm the right guy for the role? And so when I mean being intentional, it's building those champions that have credibility and juice that are going to drive your name to the hiring manager above the pile. And then I didn't physically apply for this role until I already was almost offered the role.
Right.
So that's what I would say, is be intentional about your connections. If you don't know who it is, then find someone with long years of experience in the role and connect with them and ask.
Yeah. Don't apply into the abyss where you're just going to try and win somebody over with a resume and hopefully you get a call.
Right.
There are people out there who are willing to help if you position yourself in such a way where they're like, I want to help this person. Bree knows it. I've had my share of people that have just been like, can you put me in touch with someone? And it's like, give me a reason that I should put my name out there, because I've made that mistake before. Hey, so-and-so's good. I truly believe in him. And then they're no longer interested or whatever it may be. It's like, you got to put in the work. And it's the same thing that we've learned as salesmen, to go out there and build your way to the point that when you get in front of the decision maker, you have an entire team of people that are supporting you, and you making it hard for them to say no to hiring you. How can you not say, right?
Yeah.
Well, this person won, this person over, this person over, right?
It's extending your political capital, right?
Mm-hmm.
At the end, you build trust and relationship with these individuals. I trust you, and that's why I would connect Lauren to you. And when you reach out for someone I know, I immediately would be like, yeah, absolutely. Let's, because you build that level of trust.
Another thing I want to touch on with this,
Sure.
and I think this gets overlooked, it doesn't have to be transactional where it's like, if I reach out to someone on LinkedIn, it's like, hey, can you help me out? Because then I'll help you out. Like, that's actually not what you want to do.
No.
Obviously, hey man, if you do this for me, I'm gonna always remember that. But I'm not doing this so that I owe you a favor. It's like,
Right.
People want to help others who deserve to be helped. So it's like, hey, I want to inform you that I am interested in joining your company, and I have done this research. I'm so intrigued, but I have some questions. Can we talk? You have the discussion. You share with them that I've done the homework. What else do you think I need to be doing?
Mm-hmm.
Do you think this is a good fit for me, etc.? Then you're at the point where you're just having a legitimate discussion, figuring out if this is best for you, and they're figuring out, do I want to help this person? Right?
Well, and a lot of the times, how many times have we been reached out to? Countless, where I've had people on the phone, not prepared, not asking the right questions. You can tell they didn't critically think about their discussion. It was simply,
Oh, yeah.
would you be comfortable introducing me? It's like, you showed me no level of preparedness for this role. You're only somebody's
Yeah.
kid where I know their dad.
Right.
And I'll tell
Don't
your
make this
dad,
awkward for me and I'm going to say no just because you
yeah,
called, dude.
yeah. I mean, or random people. And I've had other individuals who've come to me and it's like, I have the resume. Here's my 30, 60, 90. This is what I've done so far. And I'm like, hell yeah. Like
Yeah.
that's the level of individual you want going for this role, because frankly, it's the only ones that are going to survive.
Right. Right. And what I try to do is educate people on like, this is what you need to do to even start being considered as someone that people will want to help to get a job.
Yeah.
Right. Because some people just don't even know. They're like, you know, it's hard to see the forest through the trees. You're in the middle of it and you're just like, I just want to get a job. How do I do this? So a lot of the times I'll just tell them, you know, do some research, go to this website, blah, 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 and then reach back out to me in a week. No call.
Yeah.
All right.
I do want to touch on,
right.
interject.
Right.
I always look for people. I tell them, I'm like, I don't give a shit if it's midnight. Text me. Let me know. Like, ask me questions. Call me anytime. If I don't pick up, doesn't matter. I will text you back when I have a second. And you don't want to be a gnat, but you gotta show that level of interest in being relentless. If someone gives you their number and says I can write them, I write them. I'm like, yo, does this sound good? Yo, can we talk? Hey, what's going on here? And a lot of the times, especially, I'm not going to say this newer generation because it makes me sound old, but a lot of the times they feel uncomfortable reaching out and applying pressure. But it's like, no, I'm busy.
Mm-hmm.
Like,
but you're giving them the leeway to say, it's okay. Just because I don't answer doesn't mean I don't care. It's just that I'm busy. I will get back to you.
Well, because how many times have we been in that position? It's like, am I bothering this person? I don't want to write them too much and annoy them. So I put it out there up front. You're not going to annoy me. I don't care. If you have any questions, let me know. If you want to send me something to review, shoot it over. Just make sure it's clean. And if you want to get on the phone and talk, let's talk anytime. And I've had so many people where they don't follow up with it. They're not aggressive in getting a hold of me or aggressive in following through with what we stated. And so, like, as a mentor trying to help them out, they have to reciprocate.
That's how a lot of people will fall in love with you, is your cadence in speaking with them. And it represents how you would handle a customer, right? Customer didn't get back to you. Are you going to sit there for 2 months just, I don't want to bother them, right? Then you're never going to get the deal. But obviously you don't want to overburden them and just, annoy them. You have to figure out that way in which you're going to do it. But especially when someone says you're welcome to reach out and you don't, it's like, why would I want to help you?
Right.
You know? How are you going to, you're a representative of me if I'm telling someone you should look at this person. So build your champions, just like you said at the beginning.
Build your champs.
Thanks for watching. I hope that gave you some real insight. And if you're serious about getting into medical sales or someone you know, send them to me, medsalesblueprint.com. I have tons of resources, tons of content that help people on their way to get into medical sales fast. Phenomenal industry. You know it. People need help getting in, and that's what I'm here for.